Hi there, my name is Jaymz Goodman, and I was diagnosed with T-cell acute lymphoblastic leukemia back in 2015. So it has almost been 10 years since my diagnosis and remission. And I've been asked what survivorship means for me. So there are two ways of looking at this. One is from a clinical aspect, and two is from a personal aspect. From a clinical side of things, survivorship is 5 years post remission. So whenever you've been diagnosed and treated and are in remission and then are what is MRD negative. So there's no residual disease. They've done all the tests. They've checked you out and then they've told you that there's nothing left. 5 years after that is when you are considered to be a survivor and you are considered to be cured. Now, it's ethically non-ambiguous and it defines a patient having had successful treatment. Obviously, that's fantastic and they're clinically celebrated. But you're only cured at the 5 year rate just because of the high relapse rates. Obviously, this isn't fantastic as a patient because there are a lot of experiences that you go through during those 5 years and also during treatment. So, in personal terms, survivorship for me is understanding how to live your life again after such a life-changing diagnosis. You become acutely aware that life is short and also that things are much more important or less important than you ever thought that they were. I think as a teenager, as a child, when acute lymphoblastic leukemia comes into your life more predominantly, that you think you're bulletproof, that you're completely indestructible. And then all of a sudden you find out that you're not and that you could actually die. I recently spoke to another survivor friend of mine, and we were discussing about big things in life. And you realize that when you're going through treatment and afterwards, that life actually falls into two boxes. It falls into, am I going to wake up tomorrow or am I not? And that's quite hard to come to terms with when you're supposed to live forever. You're a teenager, you're a young adult. Things aren't meant to be so black and white. They're supposed to be, oh, there's an infinite amount of possibilities. And then you spend enough time in hospital and you realize that that's not always the truth. And you spend an awful lot of time around people who are ill, especially times where you'll spend countless hours, days, months, years getting to know people that have a similar diagnosis to you and they might not be here anymore. And you have to become aware that if you are one of the lucky ones to survive, because the rates are still not fantastic, that you've got to process and deal with that. I would say from a personal experience of going through it, it's hard. There are good days and bad days. There, even 10 years on, there are good days and bad days. Some days I become very aware of my mortality and become very aware that I'm not going to be here forever. And then there are some days where I just think I am never going to die and nothing bad is ever going to happen to me, even with all of the bad stuff that's already happened to me. Going through a tremendous, grueling 3.5 years of treatment and understanding what that means for me still to this day affects my how I go about living my life. I think some of the challenges include, as I said, being aware of your mortality and also this conversation around normal. So, for most of the people that I've ever met and myself, going through some sort of life-changing diagnosis or treatment, especially with ALL, there is this brand of normal which nobody ever had beforehand, and you then have to figure out what it means for you after treatment. So normal for me was getting up, going to the gym, doing, now I'm an adult, going grocery shopping, doing the things that for most people just seem, monotonous or the day to day. And then sometimes they actually become a little bit special to you because you had such a lack of agency and such a lack of control in your own life. I think for the year of intravenous chemotherapy and then the 2.5 years of maintenance afterwards, it was very much wake up, go to hospital, have my treatment, have my pills, and then eventually At the end of that, it all stops and you are just put out into the world. And the question you have to ask yourself is, what next? And that's where this idea of normal comes in, because you have to redefine what your new normal is. Now, for everybody, normal is different. For me, as I said, normal is go to the gym, do my grocery shopping, go to work. For some people who are affected much more in terms of long-term side effects, normal is it's very different to what it was probably prior to their treatment. I, for one, had a hip replacement as part of the side effects of the treatment. So I had steroids as part of my treatment, and the steroids caused vascular necrosis in both of my hips, and therefore I needed one of them being replaced. Now, this meant that I couldn't run anymore, and prior to having treatment, I was an avid runner. And so my new normal meant that I couldn't run anymore. So I took up swimming. Now, do I love swimming as much as I loved running? No. But have I found my own special way of enjoying it and finding it meditative and to find more joy out of the little things because of being able to swim rather than run? Yes. You have to change your perspectives. And while some people might find that really difficult, I actually found it um, easier because I still had something that I could focus on. So yeah, it's redefining what is your new normal. Um, I think advice that I could give other people going through treatment, either at the start, middle, end, probably protect your mental health. This can be in many different ways, but the first is to really ask questions of your healthcare providers, really get to know what it is that you're about to go through, because I, for one, wasn't really told very much. I just went in head first and then I dealt with things afterwards. I didn't know how my body was going to change. I didn't know what the side effects really were going to be. I took each day as it came, and I think sometimes that left me worse off than if I had known all of the specifics to begin with, so I could look out for them and then work with my healthcare providers to mitigate those problems. So ask the questions, don't be afraid. It's going to be bad anyway. So the best that you can do for yourself is to be as prepared for it as possible. So with protecting your mental health, it's also have something to focus on, whether that's gaming, whether that's reading, whether that's socializing, whether that's a hobby. Um, Obviously, some things are impacted, like neuropathy in your hands because of chemotherapy, your immune system being down. So I found one of the greatest things for me was gaming, and it gave me a tremendous release because then I was able to focus on something for 15, 20 minutes, half an hour, days at a time. And that I knew I had something to go back to, something that was consistent, and something that, even though it might be considered to some as wasting my time, it was something that was a constant and something I knew that was always there for me. Another one is understand if you're going to have steroid treatment, understand how that's going to affect you, be it mood swings, be it weight gain, weight loss. Uh, really ask and try to understand how your body is going to change. Also, because of the physiological side effects of some of the treatment, ask how to mitigate some of those issues, whether it's resting, whether it's changing diet, whether it's having some sort of mitigating treatment as well. Really get to understand how your body is going to change and what you can do, if anything, to help mitigate the issues that are going to arise as a part of your treatment. Understand things like difficulty having PICC lines and maintenance of PICC lines, but very much understand and try to know that there isn't really very much that you can do about it. You just have to be in the right place at the right time and know that if something is going wrong, then deal with it. Or if you're having a good day, make the most of it. Because good days come few and far between, and you want to make sure that you've got some nice things that maybe not plan, because things and time can change, but make sure that when you are going to be able to have a good day, that you know that you can go out and do things, that you can see people, that you can, yeah, be normal, right? Um, for me as well, in terms of getting started and then during and post treatment, I think I would have been a lot better off had I been told to go to therapy earlier, and then also to start looking after what it means to be a cancer patient and to be a survivor earlier. It took me many years post treatment to really go to therapy and to work through what I had been through. Obviously, being around people that die, being around people that are gravely ill, being around people who have had the same treatment as you and passed away affects you more than you would know. Um, and at the time, I thought that I could deal with it really well, and that I knew it was, going to just be something that was half of the course. And then eventually it hit me because there are a lot of people that I have met that have passed away. And as a young person, to become so acutely aware of my own existence and to be so aware of other people around me that have passed away was really difficult. I've been to more funerals than weddings. And for any sort of person that goes through that at a young age, suffers probably more than people who have had time to accept that life isn't infinite. Do be aware that with your immune system changes, that there are now quite a lot of instances of people having their immune systems entirely reset. For me, going through treatment meant that I needed to have all of my childhood vaccines again. That was a complete shock to me and a complete surprise. I had no idea that that was going to happen. And so rehabbing my MMR jabs, my uh, TB, all of that stuff. I had no idea that that was going to be the case. And then, so when I was a year post treatment, so 4.5 years afterwards, sat down with my healthcare provider, and she was like, "Hey, we need to just check if you've got any of your childhood immunities left, because there seems to be a heightened amount of people that don't." It turns out I didn't, so I had to have them all again. So just be aware that that's also something you might have to go through. On fertility as well. So when I first went into hospital, I was bombarded with the fact that my fertility might be massively affected. So for women, this is worse because it may make you infertile completely. It may sterilize your eggs, which is something to either consider before treatment. So to have egg freezing, which again is a terribly invasive procedure, but is something important if you want to quote unquote naturally conceive, um, or conceive with your own eggs at a certain point in the future. For men, during treatment, you'll probably be infertile, and then there's a little bit of a shock that after treatment, there stands a high likelihood of your fertility coming back. But just something to be aware of, that during your treatment, you will probably be infertile, and that will just be the case until you finish treatment. So yeah, just be aware that again, those are more physiological changes. That is something that I didn't consider at the time until I was approached by the fertility hospital and spoken to about that I might not be fertile. And then I also wasn't told that that would be not indefinite. I thought I was going to be infertile forever and got used to that. And then eventually had to get used to the fact that, oh, I could have kids again, which is a shock to say the least. Um, I do think that survivorship is a good thing. I do think that it allows you to redefine what it means to do something with your life. I've been incredibly lucky and grateful that I've put myself forward for a lot more things than I think I ever would have, taken a lot more risks, taken a lot more opportunities that were presented to me, because I just truly thought, what is the worst that can happen? And I know a lot of people that experience and feel the same way, because truly, at the end of the day, if tomorrow isn't promised, then what is the worst that can happen? You divide, as I said, you define your life into I'm either going to wake up tomorrow or I'm not. And when you have that simplicity to your life, that you have a little bit less fear of the less grandiose things. When the biggest thing in your life is, am I going to die? Then talking on stage or starting a new hobby, or I don't know, playing guitar and singing live in front of people suddenly isn't so scary. So embrace those feelings, embrace the newfound excitement that you can get from life, and know that just because you've gone through something difficult doesn't mean that that has to define who you are, because there are a lot of people who allow it to consume them. And yes, it's terrifying, and yes, it's scary, and understanding how to be outside of the healthcare system when you have been in it for so long is terrifying. But just know that there is a light at the other side of the tunnel, and that you can then use the newfound sense of joy and newfound sense of life to better yourself, to be more present in moments, to be around people who bring joy to your life and do things that bring joy to your life as well. So really focus on, if you are very aware of your mortality, make the most of it. Don't just sit around and wait for the next thing to happen to you. Really take life for what it is and think, well, if I know that I'm not indestructible, then what's the worst that can happen?